Documentation of Service, Training for the Employees of WCHS, the Pam Dudley Center. Implementation of services must be documented by the provider and is monitored by the support coordinator at least monthly for individuals who receive group home or individualized supported living as per 13 CSR 70-3.030. The provider is required to document the provision of Division DD waivered services by maintaining the first name and last name and either middle initial or date of birth of the service individual. Nicknames are not acceptable for official documentation. If a nickname is used in the ISP, it must be identified as such with reference being made to the actual legal name of the person. An accurate, complete, and legible description of each service provided is required. This information may be included in daily activity records that describe various covered activities or services in which the individual participated. Documentation should include who, where, what, when, and how the service was delivered. It should relate to the ISP or treatment plan and implementation strategies of the individual. Further, let's note that accurate documentation means that it must agree with other documentation. It must be specific enough for a third party to read and understand what happened. The who, where, what, when, and how are questions which should be answered in all documentation. It must be legible. Recoupment or repayment of the service may be the result where documentation is not legible. Even if the content is great, it is still rejected if an auditor cannot easily read and understand what the staff person is writing. A description of the service delivered. This is more than just a listing of the things done by the supported individual. Good documentation says what the individual did and what the person did to support the individual. It also should include how that service relates to the needs identified in the individual's treatment plan. Official documentation should also include the name, title, and signature of the person delivering the service. This should be included in attendance or census records documenting the days of service, signed by the provider or designated staff, and records indicating which staff provided each unit of service. Documentation of qualifications of staff to provide the service is kept by the administrative office. Documentation also necessitates that accurate and complete time records are associated with each documentation. The time, including AM and PM designation, the service was delivered, and on what date. Staff should never guess at a date. This service could be delivered, the documentation thorough, but if it was the 16th and the staff dates it the 17th by mistake, that service will likely be recouped or repaid because the service was not documented on the date specific to the actual delivery of service. Start and stop time must be included in the documentation for MoHealthNet programs and services that are reimbursed according to the amount of time spent in the delivering of service, such as personal assistance, day hab, community inclusion, etc. An example would be the service was delivered from 4 to 4:30 p.m. The setting in which the service was rendered, the delivery of service, the outcome or result of the service should be included. Daily documentation, behavior tracking, and med administration documents are guided by federal and state rule and must be completed accurately and in a timely manner. Realize when an auditor is looking at documentation, they are trying to assess if the service was delivered as it was supposed to be delivered. Services that do not have a time factor in completing the service do not require a start and stop time, but would need to have related documentation to verify the service was provided. Example, invoices for equipment, trip reports for transportation, etc. If an individual is receiving ISL support, you would not need to state Johnny ate lunch starting at 11 a.m. and finishing at 12 p.m. unless it is noted in the ISP that this is a requirement. You would simply document the lunch and all supports which were delivered. Documentation would include service delivery as identified in the ISP. This would be found in the individual's progress notes towards the goals stated in the ISP. Sources of documentation include progress notes by direct care staff regarding situations, whether good or bad, that arise affecting the individual, and monthly provider summaries which are completed by the degreed program manager, noting progress on individuals' goals and objectives in their ISP and the overall status of the individual. One of the primary requirements of documentation is for it to clearly indicate that the service is being delivered as the ISP states it should. Therefore, if the ISP states Johnny should be encouraged to exercise at least 3 times per week and staff only documents on 2 days during the month that encouragement was given, the standard was not met. If staff is documenting that Johnny left on a walk but wasn't back within the 2-hour window, so the supervisor was called, it should be stated in the documentation exactly what part of the scenario was a problem. Was Johnny allowed more than 2 hours of alone time? Should he have called or checked in with staff to make sure that he was safe? These things would be outlined in the ISP under the altered levels of supervision. If the ISP indicates that Johnny tends to eat too quickly and needs to be given encouragement to slow down, every meal tract should include the encouragement when it was necessary for this setting. The more familiar you are with the individual and that person's ISP, the more successful you will be with documentation. Let's talk about some things to avoid in documentation. Avoid giving your opinion or making judgments about the person or their behavior. Avoid using the names of other supported individuals. When necessary, you may use the initials of other individuals, but not names. Avoid creating documentation which is not legible. Avoid documenting about staff disagreements or complaints about other staff. Documentation of these events should be limited to internal documentation which is provided to administrative staff. Grievance processes are in place for situations such as this. Medicaid is not interested in staff disagreements, nor do they wish to see it in documentation of an individual's record. Important points to remember. Number 1, who, what, where, when, and how should be part of every documentation. Number 2, documentation should relate back to the ISP. Number 3, more than what the person is doing, quality documentation tells what the person did and what the staff did to support them and how it relates to the ISP. And number 4, avoid redundant phrasing, repetitive canned statements that day after day reflect lazy documentation at best and fraudulent documentation at worst. Each ISP will contain outcomes and goals. Those outcomes and goals are the end result which is desired for the individual. These outcomes and goals should be addressed by multiple people in the person's life, both paid and unpaid. The implementation strategies are written by the provider. These implementation strategies should be specifically addressed in daily documentation to show the service is being delivered as authorized. So let's practice a documentation scenario. The following is a goal which would include a specific implementation strategy. The goal: Dinah will be given choices and opportunities to be a valued part of her community. Good documentation would identify the staff, which is you, and the individual, which is Dinah. It would identify what event was upcoming, Dinah's choice related to attending the event, the setting of the event, and all supports delivered during the event. Supports could be assisting her in the restroom, ordering from a menu, mobility assistance, paying for purchases, any behavioral supports which are delivered, and supports in transportation if applicable, etc. Your goal in documentation is to identify your support of Dinah in accordance with HCBS regulations. An auditor should be able to read the documentation and clearly understand what service was delivered and how it was performed.